Now, many women are very surprised to find that they have pain with intimacy after having a baby. So, how do you know what's normal and how do you know if it's time to get some help? Let's first just go over why do we have pain with intimacy after having a baby? There can be many causes, but I think it helps to think of what tissue is being involved because you can break down what treatment might help when you think that way. So, if you start at the outside, your skin might cause some pain. Do you have an infection? That's something that can happen after you have the baby. So that skin you might have had tearing, so there might be pain because you had stitches. Or you might have pain because there's hormonal shifts. So let's say that you had your baby and you're breastfeeding, and now your estrogen levels are low. And when you have low estrogen levels in your vaginal tissue, that skin can get really sensitive. It can get painful. It can even have little micro tearing. So you might have pain just from skin issues after having a baby. And then if you go to the next level in, now we're at muscle. Again, if you had any stitches, the muscles might not be so happy there after you have a baby. There might be muscle tension there because you had pain either from the delivery or maybe you had pain even before you had a baby. But if there's muscle tension in your pelvic floor, that can lead to pain with intimacy. If the muscles are very, very weak after having a baby, sometimes that can impact how it feels when you are intimate with your partner. So there can be different things that actually cause pain with intimacy. And by breaking down where it's located, that can really help you get the right treatment so that you don't have pain anymore. Now, let's talk about what's normal. Okay, if you deliver a baby, whether it's by C-section or vaginal delivery, if you've just had a baby, let's face it, your pelvic floor's been through a lot. Okay, you were pregnant for 9 months, and then especially if you had a vaginal birth, you had a baby go through the vaginal area. So those muscles get quite stretched and they need time to heal. And there's nerves that are involved there as well, and they need time to heal. So the first couple weeks, you're going to most likely have some mild soreness. It varies from person to person. That would definitely fall within the norm. You might have temporary sensitivity or even pain if you did have stitches. But all of that should be improving over time. So there should be, if there was pain, it should be a little less the next time, and then it should start to go away. Or if you had a lot of vaginal dryness, you can use a vaginal lubricant and see, does that help? Does that help the pain go away? Okay. What's not normal is ongoing pain months after birth. What's not normal is feeling fear or anxiety as you start to get close to a possible intimate moment with your partner, or avoiding those intimate moments so that you don't have to be sexually active because you're afraid that there's pain. Those are signs that it's time to get a little bit of professional guidance so that you can get back to sexual intimacy with comfort, with confidence, and so you can enjoy that time as well. Because nobody should have pain there, despite having a baby. So, if you've got pain that's lingering, if you've got pain that's making you avoid intimacy, don't just push through it. Be sure to reach out for help. You can reach out to someone like myself. I'm a pelvic health physical therapist or another healthcare provider. We can treat you virtually where you don't even have to go into a clinic. But definitely reach out for guidance. You want personalized help so that you know exactly what you need to do for your situation. And if you're somebody who doesn't have pain right now and you're just watching videos to help get ready for having your baby, well, then you can check out my course called Pregnant and Prepared. The link is below. And what we do on that course is teach you how do you actually prepare your pelvic floor for delivery? How do you protect it during delivery? And what can you do right after you have your baby in order to help healing so that you're much less likely to have problems such as pain with intimacy? My name is Angela Fishman. Reach out if I can help you, and here's to your great pelvic health.